and local communities like Oakland and Alameda County is going to accelerate the delivery of vaccines and get us back to normal as quickly as is safe and possible. I talk to mayors all over the country, and I cannot tell you how lucky we are in California to have Gavin Newsom as our governor. He is out hustling, just like, your outfield, Dave. He is out hustling for Californians every day, and today is evidence of that hustle. This site is not going to in any way impact the existing vaccine resources, the existing workforce resources. This is truly additive from our federal partners who have been with us from day one. Governor Newsom, thank you for taking such care of California's people. Oakland and Los Angeles could not be more proud to host these first pilots from the federal government to accelerate the distribution of life-saving vaccine so that we can fight our real enemy, and that is COVID-19. It is my incredible honor to also recognize the other elected officials that are here today that have worked as a team. And Dave, teamwork is what makes the dream work. So I do want to recognize our council member for this district and a member of the Coliseum Joint Powers Authority, Councilmember Treva Reed. Council member at large, vice mayor, and also a member of the Coliseum Joint Powers Authority, Rebecca Kaplan. I'm just going in order, so don't take this personally. Our incredibly hardworking director of Alameda County's health agency, Colleen Chawa. Our esteemed state assembly member, Rob Bonta. Alameda County Supervisor for this district, also a member of the Coliseum JPA, Nate Miley. You will hear later from the President of the Alameda County Board of Supervisors, Keith Carson, as well as our State Senator, Nancy Skinner. So thank you everyone for working as a team to get this done. It is my great honor to introduce to you the great governor of the state of California, and always a recovering mayor, Gavin Newsom.
I appreciate that, Madam Mayor. Thank you for your generous remarks, and thank you for recognizing all the esteemed leaders here in Alameda County. I just want to acknowledge Alameda County for their excellence. When we look county by county, all 58 counties here in the state of California, one county stands out in terms of their speed to administration, taking vaccines and getting people vaccinated, and that's Alameda County. So I want to just recognize their partnership, their stewardship, their commitment to the cause that unites us here today. The cause that unites us here today has been amplified by our new president, President Biden. We are pleased and privileged, as they announced earlier in their press conference nationally, to identify here California as one of their first pilot sites for over 100 community sites, large mass distribution vaccine centers all across the United States. California will be launching not just this site here in Oakland, but also a site down in Los Angeles at Cal State LA. The whole idea is to speed up the throughput, the efficiency, maintain an equitable lens in terms of the application and distribution of the vaccines. Equity is the call of this moment. The reason this site was chosen was the framework of making sure that communities that are often left behind are not left behind. They're prioritized in terms of the administration of these vaccines. As a consequence, we are blessed not only by the announcement of this partnership with the Biden administration, but their full federal support in terms of the allocation of the resources to help us move forward with the distribution of these vaccines. This is a partnership with FEMA and the Office of Emergency Services. We'll be working with the county and local officials, hiring local individuals from the community, creating opportunities, creating jobs for community members to distribute what we hope is a minimum of 6,000 doses a day, hoping to build from that moving forward. This, again, is one of many sites all up and down the state of California, but this will be the first site done in partnership with the Biden administration. None of the vaccines come from otherwise allocated vaccines that we will be receiving here in the state of California. This is additive. Again, this is part of a strategy all across the United States in the first 100 days of the administration to get 100 of these sites up and operational. We hope to have this site up and operational in the next number of weeks. The set goal, 16th of February, to get this site operational. If you're interested in accessing this site, we are launching in a few weeks as well statewide a new app called My Turn that we have piloted in Los Angeles and San Diego. The pilot's been operational for 2 weeks. It's been a success. The app will be made available as we believe, the most comprehensive end-to-end application of its type of any state in this country. Not only will allow you to be notified when it's your turn for a vaccine, but also allow you to schedule the vaccine and allow us end-to-end feedback from providers, providing data not only to the state, but to our federal partnership. It will provide transparency. It will provide us a higher level of accountability and ultimately allow us more efficient, effective, targeted throughput in terms of the administration of the vaccines. So you can go to My Turn today here in Alameda County, and you can get the notification benefits. The scheduling benefits will be online in a few weeks. But nonetheless, it is a site that's available for registration and ultimately for scheduling outside of LA and San Diego when the pilot, while we move away from the pilot to a full-scale statewide operation. I want to talk about this state. Everything that should be up in relationship to this virus is up. Everything that should be down is down. Let me be specific. A month ago, on the 4th of January, we had an historically high number of cases reported in the state of California, over 60,000 cases. Today, we report 10,501 cases. 60,000 less than a month ago, 10,000 cases reported today. Our positivity rate peaked, the 7-day positivity rate peaked on January 7th at 14.3%. It's now down to 6.1%, more than half a reduction in the positivity rate in less than a month in this state. Today's reported number, when you look at a 2-week trend line for ICUs and hospitalizations are down 29.5%, 30% decline in a 2-week period in hospitalizations, and a 21.5%, 22% rounded up decline in ICUs in this state. This does not mean we're out of the woods. Many are talking about this new variant, this new mutation. Many are talking about the UK variant, South African variant, and also this West Coast variant. We have done just shy of 12,000 sequences of genomics in the state of California. State leads this country in genomics sequencing. We have had a bird's eye view from day one in terms of some of these variants and mutations. Today we have 150 reported UK variants here in the state of California, 960 West Coast variants, and there are 2 versions, 2 mutations in this state, 1429, 1427. That's neither here nor there, except to say we're monitoring that variant, monitoring the UK variant, and we currently have no South African variants to report, but clearly we're monitoring that as well. The virulence, the transmissibility of those variants are obviously of concern, and that's why we have to be cautious. That's why we have to continue to be mindful. That's why we have to continue to do the things that we all know we need to do in terms of physical distancing and wearing our masks and maintaining hygiene and doing the good work that we've done to, be more vigilant at this moment, perhaps than any other moment, because we see the light at the end of the tunnel. With these vaccines, with these case rates declining, we see light at the end of the tunnel. In order to get our businesses open, in order to get our schools open, which we are committed to getting our schools open for in-person instruction. To do that more efficiently, more expeditiously, we need to continue the good work we have done in this state to continue to see that case rate decline, these ICU and hospitalizations decline, and that positivity rate. 6.1%, still not where we want to be. We have tripled the number of daily vaccines that we have administered in this state just in the last few weeks. While that's good, it's not good enough. We were in the 40s, high 40s, in terms of our national ranking. We were in the high 30s. We're now in the high 20s. We're moving in the right direction. We're above the national average. We don't want to be average. We want to do more and better. We maintain a new focus. We have a new framework. We are being more aggressive. We're enforcing rules and regulations. We're reallocating vaccines that are not being administered. I'll give you an example of that. 170,000 were reallocated yesterday, CVS had, that hadn't been administered. And we sent them over with an equity lens to have Kaiser administer half of them specifically to low-income communities. We are being more aggressive in that respect. And as many of you know, we announced a new partnership with Blue Shield and Kaiser as third-party administrators. On February 15th, we will have that contract made public. Details of that will be put out. 2 nonprofits, no profit in this process, all about logistics, warehousing, all about making sure the equity frame is advanced and there's provider accountability across the spectrum. So we're enthusiastic about that to build on this momentum, but we're not slowing down. We are moving much more efficiently and quickly. Good news in closing, before I introduce Senator Skinner, is the federal government's doing the same. Now, we recognize what you recognize. There are parts of the state that are already running out of vaccines, where they're throttling back in terms of their dose allocation because they're running out. Federal government doesn't have the doses to support states like ours at the scale we all would like to see. We are limited on the basis of supply. This week, we will receive 1,060,000 doses of the vaccine. That's encouraging. We are averaging over 1 million vaccines being administered at this moment a week, and so we certainly can keep up with that rate. This is a flywheel. We'll only increase that pace and distribution, but it's an encouraging sign, and we, of course, will be looking, as every other state, every other governor in this nation, looking forward to the single-dose vaccine, not just Moderna and Pfizer and the 2-dose regimens, but the Johnson & Johnson that can't come soon enough that will ultimately help really fast-track the throughput. Also, in closing, forgive me for lingering beyond perhaps my allotted time, we also were pleased to hear, as many of you did yesterday, that on February 11th, the Biden administration, in partnership with pharmacies all across the nation, will be allowing direct allocations to pharmacies for traditional administration of vaccines. I say traditional because many of you get vaccinated at pharmacies. You get your flu shot at pharmacies. We'd like to see, with ample supply, an abundance of supply, your ability to do the same in pharmacies all across this state. That first commitment was announced yesterday by the Biden administration. It's additive and it's encouraging. So new partnerships, partnerships that are meaningful, partnerships that are targeted, partnerships that are focused on equity, focused on throughput, efficiency, partnerships that build on the existing infrastructure, partnerships that magnify our resolve and commitment to do more and do better. No one is satisfied with the pace of distribution of these vaccines. Of course, we have more work to do, but we have made demonstrable progress, and we will continue to build on that over the course of the next days, weeks, and months until we eradicate and eliminate this disease and move forward, as we will, more resilient, more capable as a state and a nation. And that's a day we all look forward to. And today we're marking and planting a flag of a different mindset, a different framework, a different partnership with the federal government. And for that, we are grateful to the Biden-Harris administration. With that, let me introduce your senator, Senator Nancy Skinner.
Thank you, Governor Newsom. Thank you, aides. Thank you, federal administration. Thank you, Mayor Schaaf, and all the other partners that are here. Governor Newsom just gave some great data on the drop in cases in California, the improvement that has been made. You know, everyone knows the just horrific surge of COVID and the number of deaths that California was experiencing and the incredible pressure on our hospitals due to the high number of COVID cases. But what I want to be very clear about is that it is Governor Newsom that we can thank for that drop. Yes, the public followed the orders, but if that public health order of the reinstating of the stay-at-home had not gone into effect, and their medical professionals just released a report documenting this, that if that had not gone into effect, we would not have made the improvements that we made. And while all of us are frustrated, we want to be able to, sit outside and get a meal or do the other things. We're tired of this pandemic. We're tired of this virus. We are doing the right things in California under Governor Newsom's leadership, and we have brought that surge down, and now it's upon all of us to make sure that we keep that surge down and that we go about our engagement in the new activities that are opened up again, but we do them as carefully as possible, and we wear our masks, and we keep our distance so that we keep those COVID rates down. But I really just want to thank Governor Newsom for that. And now, what a relief that we have a new administration and that we now have some order to this vaccination rollout. Under President Biden, look, anybody watching the news, every single state is frustrated. When are we going to get our vaccines? When can we have consistency of supply so we can plan? And that was complete chaos before President Biden came in. Now what we see is an order and some deliberation, and we can all breathe a sigh of relief. So this partnership is the perfect example of that. And thank goodness we have, as Mayor Schaaf pointed out, a Governor Newsom, who hustled and made sure that President Biden paid attention to California and that we have this partnership and that we get to open up these sites here in Oakland and in Los Angeles, in communities that were particularly impacted, so we can get as many shots in the arm as possible, as quickly. Now, we know this virus, COVID-19, has been having the upper hand, and we got to get it down from not having the upper hand. And if we don't get vaccinations in the arms as quick as possible, COVID's going to continue to what they call a virus mutates. And when it mutates, it changes form, and it can do other things, and it could potentially cause us to lose a lot of the great gains we've made. So we need incredible partnerships like this, where we can still have the delivery of vaccines that we have. If you're a Sutter member, a Kaiser member, whatever, the other ways that are currently now delivering vaccine, that in addition to that, we can have this new influx of vaccines from the federal government at these mass sites like the Oakland Coliseum in impacted neighborhoods. So thank you, Governor Newsom. Thank you, President Biden. And thank you, ACE and City of Oakland and all the other partners that are going to make this happen. Get vaccines in the arm quickly. Thank you.
As president of the Alameda County Board of Supervisors, along with my colleague Nate Miley and also our healthcare agency director, Colleen Chawla, I want to say, first of all, thank you to President Biden. Thank you to Vice President, our own Kamala Harris. Thank you to FEMA. Thank you to the Biden administration for this opportunity. I also want to say a big thank you to our governor, Gavin Newsom. Our counties and I have had an opportunity to work with Gavin Newsom since he's been governor. He has always been present around the flooding that has been taking place and keeping local government in the loop and involved in that, around the fires that we've had. And since this pandemic has hit this country, since last March, Governor Newsom, his administration, the healthcare agency director, Director Ghali, and others have been on calls almost every single week regarding this pandemic. I know that at least I've been on 3 calls every single week in which the administration, Secretary Ghali, has been gathering the 58 counties to say, how do we get rid of this pandemic? And for that, I want to say thank you for your direct involvement and your administration involvement. The word that I heard today was partnership. Federal, state, and local government coming together in a partnership. And that's what it's going to take in order to beat this pandemic, in order to deal with this virus. Alameda County is the best place to kick this off because we reflect the rest of the United States, we reflect California. We have urban communities, we have suburban communities, we have rural communities, we have old individuals, we have young individuals, we have physically challenged individuals all living here. We are a diverse community with multicultures and multi-languages all here. And the ability to partner in order to deal with this virus that is killing people across this country, around the world, a virus that is almost going to be equivalent to that of the Spanish flu of 1918 that killed almost 50 million people by history around this world. And unless we have this kind of a partnership, which have come together through the Biden administration, through our leadership here at the state from Gavin Newsom, and from local government coming together, it's going to take this kind of partnership to go out into the community and make sure that the least amongst us, those who are living on the street, those who are unsheltered, to those who are living in million-dollar mansions, have the ability to make sure that they equally can come together and get this shot so that we can beat this virus. So again, thank you very much for your leadership. Thank you again for the Biden administration for the partnership, and the local community is going to come together to make sure that every single one of us is vaccinated. Thank you very much.
Thank you, Supervisor. Again, thank you for your outstanding work, and thank you for your generous words and your incredible leadership. We are happy now, of course, to take any questions. I want to just also recognize someone who's not here, but has been instrumental in getting this partnership developed, and that's Bob Fenton, our regional director at FEMA, has just been an extraordinary partner through multiple administrations, and of course, Mark Gilladucci, the head of our Office of Emergency Services. As I noted, this site is being stood up in partnership with the Office of Emergency Services and FEMA, and we'll have the support of staff that includes members of this community. That happy to take any questions.
Thank you, Governor. Bob Marzani here with KQED. Thank you for taking questions through the pool today. You mentioned the limits on supply. What guarantees have you received that there will be sufficient supply of vaccines at these sites so that they can actually accelerate vaccination?
So we have strong, we have been told that these allocations will allow for us to get up to 6,000 doses administered on a daily basis, and that all of the requisite supports, not just the doses themselves, the vials, but all of the PPE and related support will be provided by the federal government in an additive manner, not in a way that takes away from our ongoing and existing capacity. They have secured our confidence, and we maintain that confidence in the administration that those doses will be forthcoming and those supports will continue, not just episodically, not just for the kickoff of this site, but for the weeks and months ahead.
And you said that the state began its planning around vaccine distribution back in April, but obviously in recent weeks there's been a number of significant changes to the state's plan. Can you point to a place where that initial vaccine strategy broke down, and perhaps if you could go back and do anything differently around the vaccine distribution strategy, what might it be?
No, we built off a well-treaded system, one that's been designed and developed over the course of quite literally decades. And that's the system that's very familiar to Californians, and that's the 19 or so million flu vaccines that are administered on an annual basis, and the vaccine regimens that exist and persist for other vaccines that people get on a daily basis all up and down the state of California. We built off that framework. It was bottom up, not top down. Localism being ultimately determinative, driven by the counties as the intermediaries, making determinations and distributions to providers. What we realized is in that process there was some opaqueness. It wasn't kind of transparency we were hoping for, and there were certain counties outperforming, certain counties that were not performing as well or as effectively as we'd like to see. We've begun to tighten that up, developing a framework of partnership, allowing the counties, maintaining the partnership to allow the counties to lead on equity. But we realize the sophistication that's needed in a framework of episodic distributions from the federal government where there's not certainty in terms of supply and the issue of scarcity being in front of us in the next few weeks. Mindful of all of that, we wanted to develop a different framework, and that's what we're doing to build off the existing framework with this third-party administrator. And no one better than Oakland's own headquartered company, one of the largest nonprofits in this state, Blue Shield, that is in the network management business. And they have a provider network of over 64,000. And their capacity to do data analytics, their capacity to hold providers accountable, to do payment processing and incentives is second to none. And so we want to build on that expertise, and that was developed over the course of this iterative process and the application of these efforts. And I can assure you, talking to governors as I do quite literally, not on a weekly basis, a daily basis, every state is iterating in this process based upon unique conditions and challenges that all of us face.
Sure, you've seen there was some statewide public polling released yesterday. 2 surveys both showing low public approval of the state and your administration's vaccine rollout. What's your reaction to that? How do you rebuild public confidence in the distribution process?
We've tripled the number of vaccines being distributed. We're here today to mark the first partnership in the nation with the Biden administration, not only here in Northern California, but in Southern California. Our vaccination efforts have gone, as I said, from the high 40s, high 30s, now the high 20s. We are making progress. And when you look at where we are in terms of large states, we're in the top tier as of this morning compared to other large states. And we're just getting started. We're just moving forward aggressively. And I think you will see those numbers, those vaccination numbers, continue to increase. And we are mindful that we have to get more support and supply, not just from the federal administration, but more support and supply directly from these manufacturers, not least of which Johnson & Johnson, which we believe will be a game changer and allow us throughput with that single dose regimen that will ultimately allow us as a nation, not just as a state, to turn the corner.
And on the decision to partner with Blue Shield on distribution, what does the state think Blue Shield will be able to accomplish that others can't? And given the quick timetable of bringing them on board, the contracting process, how do you respond to any criticism that Blue Shield might be being favored for its political support of you in the past?
It's nonsense. We had a partnership with Blue Shield that was developed by a team of experts. We've got dozens and dozens of individuals that are working on our vaccine rollout. We've got a community advisory committee. We have got a distribution advisory committee, what we refer to as the guidelines working group. We got a team of experts. Everybody came together looking at what's working, what's not working, and we identified 2 partners, in particular 2 nonprofits, Kaiser and Blue Shield, both offering unique experience, well-established companies here in the state of California. They have the kind of scale, they have the capacity, they have the allocation distribution mindset that we were looking for, and that's why the team recommended this partnership, and I concurred.
Governor, the CDC has said that teachers do not have to be vaccinated in order to safely reopen schools. I'm wondering what you make of calls from some teacher unions in the state who disagree with that guidance, and also where do negotiations stand with the legislature over the short-term budget plan to reopen schools? And with the Senate budget chair here, perhaps I'd love to get your perspective as well.
I want to safely reopen schools, and I don't want to do it episodically. I want to do it in a sustainable way. I believe you can safely reopen schools in this environment. One we've put out in terms of a framework to the legislature is a plan that includes $6.6 billion of early action to help not only with PPE, but to help with testing, to help with other protocols and supports in terms of ventilation, in terms of social distancing and physical distancing within the classroom and outside the classroom. We have many districts that have schools open and have been able to do it safely. Let me be specific. In January, we had 87 reported cases of positive cases in our schools. That's down from where we were in November, December, despite January being a record month in terms of community spread and positivity. I subscribe to the Biden administration's point of view, reinforced again today in their press conference, that we can safely reopen schools with appropriate level of support. So the framework that we put out to the legislature provides a framework for engagement and negotiation that's been ongoing over the course of the last number of weeks. I was just talking to Senator Skinner, and I'll ask her up here in just a moment, how she felt things were going. She's been instrumental in those negotiations, and I complimented her on our team's partnership. The Senate last night, just exchanging paper on nuances and details back and forth, and I'm confident we can get to where we need to go, and that's safely reopening our schools for in-person instruction, starting with the younger grades and those with special needs. I say this not academically or intellectually, but as someone with 4 young kids. The younger kids are not getting the benefits of distance learning that the older kids are. And I'm very concerned about the equity lens in terms of this conversation, because so many private schools are open. And I believe we can safely reopen public schools to in-person instruction with the appropriate level of safety and support and accountability in terms of enforcing the rules of the road. And we are committed and resolved to doing that in partnership with the legislature. And I'll ask Chair Skinner to talk a little bit about what their timelines look like, but I'm very encouraged by the progress.
Thank you, Governor. No one in their right mind wants to get COVID-19. So, of course, we have legitimate concerns by whether it's teachers, parents, what have you, around if we're going to open schools, let's do it safely. But I'm confident, and we know the governor wants the schools open safely, our schools want to open safely, and the legislature wants to get schools open safely. And we're just hammering out the details to do that, and I'm confident we'll get there.
It's that same spirit that brought the legislature and this administration together on the evictions protections. We have the resolve, we have the mindset, we have the relationships. I'm confident that we will land this thing and very, very soon.
And Governor, I'd love to get your reaction to your home city and county of San Francisco suing SFUSD, saying it lacks a clear reopening plan. Might that be a consequence if there isn't this kind of state framework established? You see more local governments kind of acting on their own in this manner.
Well, we're putting out a statewide framework providing an unprecedented amount of support. By the way, our budget that we submitted has the highest level of funding in the history of the state of California for K through 12 education. We are providing above our minimum mandate under Prop 98 billions of additional resources, and we are working very, very closely with the legislature on pulling forward $6.6 billion in an early action package to address the issue of learning loss. Learning loss can be addressed at the local level with the kind of flexibility that San Francisco Unified, Oakland Unified are looking for. Learning loss may include extending into the summer, may include extending the school day. It may include extending the supports by providing more counselors and more intensive mentorship. We have no idea what each and every district needs versus every other district. There's 1,050 of them. But we have one fundamental recognition. They need more resources and they need flexibility. And that's exactly what we're providing. And we're very hopeful those city, county, district issues will be substantially abated and resolved with the support this package provides.
And Governor, just to follow, is that argument of having a prerequisite of all teachers being vaccinated to return, is that a non-starter for you?
It's not a non-starter. I'd love to have everybody in the state vaccinated that chooses to be vaccinated. I'd like to prioritize. Not only would I like to prioritize teachers, we are prioritizing teachers. The state put out guidelines, 1B, that prioritizes teachers. We have age cohort, but we are prioritizing teachers for vaccines. We want to get our teachers vaccinated, and they have been prioritized in this state. So we want to see that happen. What we believe is exactly what the CDC, Dr. Fauci, what the Biden administration believes, that we can safely reopen schools as we process a prioritization to our teachers of vaccinations and still keep our teachers, our paraprofessionals, which means bus drivers, our cafeteria workers, janitors that are essential workers to making our schools work safe and keep our kids safe at the same time. So we are aligned with the thinking of the Biden administration.
I'm wondering if you can share any key lessons that you've learned from other places where vaccine distribution is going well, either states or even locales in California like Long Beach.
Well, Long Beach has been a great partner to the state, been a great example to the state. Mayor Garcia and I just did a call together talking about what's working, what challenges they're having. Every part of the state, there's a best practice. I noted here, Alameda County, 94+% in this morning's report of the vaccines that have been delivered have been administered. There's some counties as low as 22%, which is just unacceptable. So we're learning from those counties, not just other states. We're learning from providers. We're learning from our partnerships that include Kaiser and Sutter and others, what's working, what's not. So every single day, we take those lessons in. We have a work group. We begin the day talking about vaccines. We spend most of the day in a vaccine framework, and we end the night about what we learned from the rest of the day in terms of an all-hands call. And every day we're improving and iterating.
Question on youth sports. I'm wondering if you can react to the lawsuit filed by 2 high school student athletes in the San Diego area. They are seeking an immediate return to competition, and wondering if you could provide the latest on any discussion you're having with youth sports leaders, whether you expect a change in the rules to allow high school and other youth sports leagues to perhaps begin playing sooner than current rules allow.
Well, last week we made an announcement and that allowed for youth sports like track and field to take place. So just to level set, we are and we have provided a framework to allow certain youth sports to take shape in competition. That said, we have been in very direct conversations. Personally, I launched those conversations last week. My team is in constant contact, trying to work through these different tiers. In the red tier, you'll start seeing baseball. In subsequent tiers, we'll get to football. But I'll be honest with you, a lot of this is driven by football and folks wanting to get a football season in, and I'm deeply sensitive to that. As I said, I not only have 4 kids that want to get educated, but that love sports. And so I recognize all of the benefits, physical and mental, as well as the benefits to teachers and parents that have kids that are engaged in physical activities in terms of our responsibility to support those children as well. And so we want to see this happen. We want to do it safely. And a lot of great data has been provided by the same groups that are suing us. And if I was concerned about lawsuits, I would have collapsed a year ago. We receive dozens of them every week. And some of them from folks that are very close to us. So it's clarifying, allows for focus. Some are specious and political. Others, like this, I think are quite legitimate in terms of what they ultimately want to achieve. I share that, and we are processing that. And I'm very hopeful, I really mean this, I'm very, very hopeful that we can find a compromise here, and I believe that's possible as long as these case rates continue to move in the direction they're moving.
Governor, last question for you today. Your run of appointments is not yet done. When it comes to Attorney General, what factors are you considering as you weigh a potential appointment? What do you see as the priority for that position in the next 2 years?
I think there are 5 candidates for Attorney General behind me. Maybe this is kind of like I don't know. I don't want. We'll make this like a reality TV show. You can ask them some tough questions, and we'll see how they perform. I'm very close to making that decision. Some extraordinary people that have not only sought consideration, some that haven't sought consideration that I believe would make outstanding Attorney General, but we're very close to making that decision. Here's a consideration that is quite sincere, and I want to make this public in a more contemporary terms. Our current Attorney General is still the current Attorney General, has not been formally confirmed by the United States Senate. And so the timing of a public announcement will be determined on the basis of that confirmation. And so just know that. We hope that happens sooner, I certainly do, than later. With that, let me thank everybody again for being here. Thank the incredible leadership in Oakland and Alameda County, and thank you to the Oakland A's for opening up this site. Thank you, everybody.